So the ultrasound shows that the baby is fine, but let's schedule another appointment to administer a quad screening to test your blood level since your firstborn had a neural tube defect. But don't worry, this test will allow us to make sure that the baby's doing well. And in the meantime, I want to increase your intake of folic acid because it'll help the baby grow and it will promote a healthy development. Are there any questions for me that you have to ask?
Yeah, so what is folic acid? How can it help me?
So folic acid is just another name for vitamin B, and it helps every cell in the body to grow and develop healthy.
And how would I be able to get folic acid?
Oh, you can get it from the food that you eat. So you look for the food that you buy that is labeled with like fortified or enriched or folic acid. You know, some flour, bread, cereals, pastas, etc. You can also get vitamin B from like leafy green vegetables, beans, orange juice. Yeah.
And how much do I get? Like, how much do you consider that's enough?
Oh, that's a very good question. So normally I would tell my patients to get about 400 micrograms of it, but since you've given birth to a child that like already had a neural tube defect, I would want you to do double that amount, so 800 micrograms. But you also have to eat a lot of the foods that I mentioned before to get the right amount of folic acid every day. But it's best if you take your vitamin pill. So here's the prescription, and here you go.
Okay. Thank you. So I guess I'll just see you next week.
Yes. See you later.
See you.
This is not the only woman who experienced a loss from a neural tube defect. Folic acid is a common vitamin to help take preventative measures towards decreasing one's chance of having a baby develop a neural tube defect. This patient gave birth to a child with a neural tube defect, and a month after she gave birth, the baby passed away. She is here now to prevent this with her second pregnancy and to get the folic acid that she needs. Here to explain more to you about folic acid is a nurse practitioner.
Hello.
In Europe, about 4,500 births are affected with neural birth defects, or NTDs, yearly, and the annual costs are around 15 million euros. In Germany, 2 babies in every 1,000 born babies have NTDs, and before now, we have never had an educational campaign. But the truth is that NTDs can happen to anyone. NTDs form in fetuses within the first month after conception. This is why it's very important for any woman who's planning to get pregnant to get the right amount of folic acid. And even after getting pregnant, women should continue to take folic acid. Studies have shown that folic acid is an effective method to prevent NTDs, and in some countries it has reduced NTD by at least 25%, in some places even higher than that. If you're pregnant or planning on getting pregnant, make sure to talk to your doctor to get the right amount of folic acid to have a healthy baby. Give your baby a chance to develop and live healthy. Take folic acid today.